Okay, hello, I'm Brianna. I'm going to be your student nurse today. Today I'm going to be teaching you about your new prescription you got called bupropion. Before we start, can I ask, do you know anything about this medication?
No, not really.
Okay, that's fine. Today I'm going to be teaching you about the medication. Okay, let's start. Okay, so patient summary, MA is a 20-year-old African-American male admitted for a 3-day detox hold due to polysubstance use, including marijuana, cigarettes, ecstasy, mushrooms, Percocet, and Molly. He reports using drugs for the past 3 years, starting at a party with friends. He currently smokes marijuana and cigarettes daily and uses other substances about 3 times a week. He does not believe he has a problem as he maintains a job and a daily routine. He knows drugs are harmful, but thinks because he is young, drugs won't affect him right now. Patient states he currently has no desire to quit smoking or stop doing drugs. MA lives with his parents and younger brother, has his GED, and works at Goodwill. He denies any personal or family history of medical or psychiatric disorders. He also denies family history of substance abuse. He appears underweight, but is well groomed and appropriately dressed. There are no abnormalities in his speech or gait. His mother brought him into the hospital due to her concern over his drug use. He says drugs help him feel good and energetic while smoking relaxes him. Without it, he feels aggravated. So, the nursing diagnosis related to the medication is ineffective health maintenance related to nicotine dependence and use of smoking cessation, pharmacotherapy, as evidenced by continued tobacco use and no expressed desire to quit smoking. Okay. So what is bupropion? This medication is a prescription medication under the class of antidepressant. It is mainly used to treat depression and help people quit smoking. However, it can also be used to treat anxiety, seasonal depression, and ADHD. In your case, it is being used for smoking cessation. Common brand names include Wellbutrin and Zyban. So how does this medication work? It works in your brain by balancing certain chemicals that affect mood. It boosts dopamine and norepinephrine, brain chemicals that affect mood and energy. These chemicals help improve mood, focus, and motivation, and helps reduce the urge to smoke and makes withdrawal symptoms less intense. So, how do you take it? This medication comes in the form of oral tablets, including immediate release, extended release, and sustained release. The common dose for this medication is 150 milligrams once daily. Your doctor might increase the dose to 300 milligrams after a while, depending if you need an increased dose or not. You'll be starting with an extended release tablet of 150 milligrams once a day. So some tips for taking the medication: make sure you do not crush or chew the tablet. Swallow the tablet whole with a full glass of water. The medication can be taken with food to reduce stomach upset. Take this medication 1 week before you plan to quit smoking. Try to take it at the same time each day, preferably in the morning since it can cause insomnia. If a dose is missed, take it as soon as remembered, but skip if it's close to the next dose. Do not double doses. Store the pills in a cool, dry place and don't stop the medication suddenly. So here I put a video also about how to take the medication. Okay, before we move on, do you have any questions so far? Is everything
No.
clear? Okay,
Yes.
go to the next slide. Right. Okay. So when will it start working? It may take 1 to 2 weeks to notice small changes. Full effects can take 4 to 6 weeks. Be patient and keep taking it even if you don't feel better right away. Even if you aren't noticing improvement, do not abruptly stop the medication. If you desire to stop the medication at any point, make sure to notify your doctor so they can help you gradually taper off the medication under medical guidance. So these are some side effects. Common side effects include insomnia, dry mouth, headache, weight loss, dizziness, sweating, and nausea. And then serious side effects include seizures. It's higher risk with higher doses or seizure history, fast heartbeat, and high blood pressure, suicidal thoughts or mood changes like feeling angry or anxious, hallucinations or confusion, and allergic reactions like rash, swelling, or trouble breathing. So if you have any of these serious side effects, make sure to get medical attention right away. Some contraindications and precautions for the medication. Seizure risk. This medication is contraindicated in patients with a history of seizures or eating disorders like bulimia or anorexia. Alcohol use, using caution in patients who drink heavily because it can increase the risk of seizures. Bipolar disorder, this can trigger manic episodes in untreated bipolar disorder and pregnancy. Discuss the risks and benefits with a doctor before use in pregnancy. So if you have any of these, you should tell your doctor before use. Some interactions, there are no food interactions, but some medication interactions are antidepressants, seizure medications, antipsychotic medications, and MAOIs, which is a type of antidepressant. These medications can interact with bupropion and raise the risk of serious side effects or seizures. MAOIs must be stopped at least 14 days before starting bupropion, or it can cause dangerous reactions. Also, alcohol, drinking alcohol while taking this medication can increase the risk of seizures and make side effects like dizziness or confusion worse. It's best to avoid alcohol or talk to your doctor first. Okay, so important warnings. Don't drink a lot of alcohol while taking this medication. It can increase your risk of seizures. Tell your doctor if you've had an eating disorder or history of seizures. Watch your mood. Tell someone if you're feeling angry, irritable, anxious, or sad. And then you should call your doctor if you have thoughts about hurting yourself, seizures, or severe side effects. Side effects aren't going away or they're getting worse. Can't sleep for many nights in a row, or if you're feeling like your thoughts are racing or out of control. So here I've attached a handout with some information that you were taught about today. It will be emailed to you so you can print it out and have a copy to refer to. This PowerPoint will also be emailed to you so you can refer to that as well while you're taking this medication. So here I have your quiz evaluation. I'm going to have you answer the following 10 multiple choice questions. This is to see if there's any areas we should go over again to make sure you have a full understanding of the medication. Please state your answers out loud after the question is read to you. Are you ready?
Okay.
Okay.
hmm
Number one, which of the following is a contraindication for taking bupropion?
Um, B, history of seizures.
That is correct. Number two, which of the following is a common side effect of bupropion?
Weight loss. B.
Correct. How should bupropion be taken to reduce the chance of stomach upset?
Um, with food. B.
Correct. Number four, if you miss a dose of bupropion, when should you take it?
A, take it as soon as you remember. The first one. A.
Okay, number five, what is one serious side effect that requires immediate medical attention while taking bupropion?
Seizures.
Correct. Number six, what should you do if you experience mood changes or suicidal thoughts while on bupropion?
Contact the doctor. B.
Correct. Um, Number seven, which condition is bupropion not typically used to treat?
High blood pressure.
Correct. Number eight, which of the following is an interaction for bupropion?
Antidepressants.
Yes. Number nine, what is a typical starting dose for treating smoking cessation with bupropion?
B.
Correct. And number 10, why should alcohol be avoided while taking bupropion?
B.
Okay, correct. So you got all of the questions right. So it
Okay.
appears that there's nothing I have to re-explain to you.
No, I understand. Thank you.
Perfect. These are the answers. And before we end, do you have any questions or anything you want me to clarify or go over again?
No,
Do you feel
everything's
like you
clear.
have a good understanding of the medication?
Yes.
Okay, perfect. Thank you for joining.
Thank you.
Okay, you could go now. Let me stop sharing.
Good evening. I'm your student nurse today, and my name is Kendall, and I'm going to be teaching you about the medication flufenazine. Before we start, do you know anything about this medication?
Um, no, not really.
Okay, that's fine. So before we start, I want to go over the psychosocial. Um, the client is a 52-year-old Caucasian woman. She was admitted due to her suicidal ideations or like her suicidal thoughts that she was having. Um, she stopped taking her medication because she wasn't feeling the effects of the medication as quickly as she wanted to. She claims that she wanted to get her mind right when coming in to the facility and that she wasn't going to leave until she felt like she had her mental together. She has one daughter. She's not married with no religious affiliation. And yeah, so we're going to start with flufenazine. So this is what we're going to go over today. We're going to go over the use of the medication, the dose of the medication, common side effects, contraindications, like bad reactions, some food that you shouldn't, food and herbs that you shouldn't be eating or like taking while on this medication. And then we're going to go over some important teaching. Before we start, I'm going to do a pre-quiz to evaluate how much knowledge you have about the drug. And then we're going to do a post-quiz to see how much you've learned after this. So we're going to start with the pre-quiz. The first question I have for you is what type of medication is flufenazine?
Antidepressant,
Okay. And what symptoms does flufenazine usually treat or mainly treat?
sadness and anxiety,
Okay. What are some common side effects of flufenazine?
um, nausea and vomiting,
Okay. Do you know any foods or herbs you should avoid while taking this medication?
grapefruit juice.
Okay, that was a good guess. What is a serious sign? Do you know any serious signs of like toxicity or like some adverse reactions that it would cause to let you know the medication like isn't rocking well with your system?
If it causes you to have like trouble breathing or like shortness of breath,
Okay. And do you know how long it usually takes for you to start feeling the effects of fluphenazine?
2 weeks.
Okay. Okay. So now we're gonna get into the actual education portion or the information. So usually with flufenazine, the normal dose is around 1 to 10 milligrams, and it is usually given in an oral tablet. Now, in the case that there's some acute symptoms or some symptoms that are very sudden, they can give it to you as an intramuscular injection. So it can be given two different ways, but you're most commonly going to see it as a tablet. And what it does is it's an antipsychotic medication. It's also known for its other brand names like Modicate and Modicate Concentrate, Prolixin. Prolixin is actually discontinued right now due to its effects on people. So you usually won't see Prolixin nowadays. You're mostly going to be looking for the other brand names that I've noted above. It helps with serious mental problems. So some things like schizophrenia or like when you see and hear things that other people aren't seeing or hearing, and if you're having like sudden and very strong mood swings, and some uncommon behavior. It usually takes about 2 to 4 weeks for the therapeutic effects to be shown or for you to start feeling the medication and to feel it working. So that's why it's usually advised that you do not stop taking the medication suddenly. You should continue the dose, and then if you have any adverse effects, which we're going to go over later, you should talk to your provider. So in this case for you, it's being given to stabilize your mood and help with your mood swings. Some common side effects to look for is muscle problems. So some muscle problems would be like muscle stiffness. Like if you feel like your muscles are really stiff, it's hard for you to move your muscles. That's one of the side effects. Restlessness. So if you're constantly tapping and moving and you're Balance isn't as steady as it usually is. That's also a side effect, and along with being sensitive to sunlight. So you might get sunburnt easy, or when you go out in the sun, you might feel like your skin is being irritated. Okay. So some contraindications of the medication would be similar antipsychotic medications. So when you're talking to your provider or the nurse, if they're giving you other antipsychotic medication for um, things that, like I said, hearing and seeing things that aren't usually there, you want to check and make sure that it's not that could be a contraindication of this medication. It's also contraindicated for things that slow down your brain activity. So things like sleeping pills, strong painkillers, things that make you tired and sleepy. You shouldn't be taking that with this medication. You also shouldn't take this medication if you have liver damage because it affects the way that the drug is processed in your system and how it's absorbed. So you want to also double check for that. Some signs of toxicity would be a low number of white blood cell counts, which will make it hard for you to fight infections, meaning that you might get sick easily or you might get sick quicker than you usually do. Another sign, a side effect would be high fever. If you're having a high fever, stiff muscles, or you're also experiencing confusion, you want to go talk to your provider and contact them so that they can help you with these side effects. Next, we're going to talk about foods and herbs that you should avoid. You should avoid alcohol um, because it's a CNS depressant or it makes you tired and it makes you fatigued, like what we talked about earlier. St. John's, kava kava, and valerian root are all herbs that you should avoid. So be careful when if you take vitamins or if you're in the store and you see something that has any of these, do not take it. It might affect the way the medication is absorbed and the way it works. So some patient teaching or some teaching that I want to emphasize for you is do not stop your medication abruptly. Like I said, it takes 2 to 4 weeks for you to start feeling the effects of the medication. You do not want to stop it suddenly because then you might go back to seeing things that aren't there, or you might have the mood swings like we were talking about. You want to avoid alcohol and drugs that slow down the brain activity, like we said, alcohol, sleeping pills. You want to wear sunscreen to protect your skin due to the sunlight irritating your skin. If you feel like your skin is being irritated, try using sunscreen and then immediately report signs and symptoms such as fever, muscles, and muscle stiffness to your provider. Okay, so now we've gotten to the post quiz. Before I start with the post quiz, do you have any questions for me?
No, I don't. Everything was explained well.
Okay, so now we're going to talk about the same things we talked about in the beginning to see how far you've gotten. So, do you know what type of medication fluphenazine is?
It's an antipsychotic.
Perfect. Do you know what okay. Do you know what symptoms fluphenazine usually is used to treat?
It's to like stabilize your mood and it's for like seeing things and hearing things that aren't there.
Perfect. Do you know what some common side effects are?
Um, Fever and muscle stiffness.
Okay. Do you remember the food and the herbs we talked about that you should avoid?
Definitely alcohol, kava kava, St. John's, and valerian root, I think.
Yes, perfect. And do you know what is a serious sign of like that the medication is toxic?
Muscle stiffness, muscle pain.
Yes.
Yeah.
And do you know how long it takes for you to feel the effects of the medication?
2 to 4 weeks.
Okay, perfect. Yes, you got all of these questions right. So I now know that you understand the medication. This is going to be emailed to you along with a flyer that sums up this medication and gives it to you just in case you forget. So if you don't have any questions for me, then thank you for listening and I wish you well.
Thank you.